Hello everyone. Stroke is a leading cause of morbidity across the globe, including India. It's also one of the leading causes of mortality. We need to be aware of stroke. Stroke happens because of acute occlusion of a vessel supplying a brain or sudden rupture of a vessel. That can be disastrous sometimes. So stroke is an emergency. We recognize symptoms of stroke by B fast mnemonic. B stands for loss of balance, E stands for loss of vision, F is facial drift, arm is arm drift, and S for speech, loss of speech. And it can happen suddenly without much notice in the prior. We recognize symptoms and action has to be taken because every minute counts in stroke. Every minute loss or delay will lead to 1.5 million loss of brain cells. So once the stroke symptoms are recognized, the patient has to be taken to a stroke-ready hospital. So what do you mean by stroke-ready hospital? So stroke-ready hospital has everything under one roof. Active ER team which can receive the patient, recognize the symptoms, act on that quickly, assess the patient and take them to a quick imaging, either CT or MR as required. And then if the patient is eligible for thrombolysis, whether it is IV or mechanical thrombectomy, taken to a cath lab and the stroke intervention is available 24/7 and a quick action is taken. This leads to a good outcome and quick recovery of the patients. Having said that, even though stroke is an emergency as I'm told, it is also largely preventable. So the common risk factors for stroke are diabetes, hypertension, dyslipidemia, smoking, sleep apnea. So all this can be modified and acted upon to prevent further strokes. Once a patient develops a stroke, important is to understand that the medications are for lifelong. So apart from the medications which has to be taken regularly under close follow-up, regular lifestyle changes as suggested lifestyle modifications have to be maintained well to prevent another stroke. Thank you.